Over 500,000 women are diagnosed with cervical cancer every year, and a lot of those women don't get diagnosed until it's too late. Over 80% of cervical cancer deaths are in low and middle income countries. But with community outreach and a simple test, this is a solvable problem. I'm Dr. Vincent DeGennaro, Executive Director of Innovating Health International. HPV is the virus that causes cervical cancer, and from the time a woman gets it to the time it actually causes problems can be 5 or 10 years. And in that window, we can diagnose and cure pre-cervical cancer. And that's the time where we need to act. In countries where I work, like Haiti and Malawi, cervical cancer is the #1 cancer killer in women. And a lot of these deaths are in women who are in their 30s and 40s, their most economically productive years, and many who are still raising young children. If we can screen all women in low and middle income countries even once in their lifetime, we can reduce cervical cancer deaths by 80 or 90%. But one of the biggest challenges is we have to convince women who are struggling already to feed and educate their children to take a test for a disease that most of them have never heard of, in a part of the body that they don't know where it is, for something that has no symptoms and that won't affect them even if they did have it for more than 5 years down the line. Even when the screening is free, we have low numbers coming into clinics. The real key is how do we promote engagement with the health system? So with a nurse or midwife toting just a backpack full of supplies and a mobile treatment device, we're engaging women by going to them instead of waiting in a clinic. At our organization, Innovating Health International, we have screened over 15,000 women for cervical cancer in the last 3 years. In our project in Haiti, we've already educated, tested, and treated thousands of women who work in factories, all during their lunch break. Anywhere we can get 3 minutes of privacy and anywhere a woman can lay flat, we can offer them these tests. There's no new technology needed. With a simple swab, we can diagnose and cure early cervical cancer with no doctor, no lab, no clinic, and even no electricity. Every mother that we educate, test, and treat, we're not only ensuring that she will be there to raise her children, but that she has, through the engagement, the knowledge to pass on to her daughters and her sons about the importance of screening for cancer in women. Anywhere in the world, no matter how remote, no woman has to die of cervical cancer anymore.